I'm Dr. Kelsey and I heal my eyes naturally. This is part 2 of my astigmatism talk. The reason I'm doing this video is because I've seen several videos on YouTube and on TikTok that were demonstrating astigmatism, what it looks like with certain powers. These videos are way too oversimplified because of the fact that they were demonstrating different powers but only one orientation. We talked about astigmatism. Your cornea is the shape of a football, where you have a flat curve and a steep curve. Astigmatism affects your vision much less in a horizontal than it does in the vertical, and even more so in the oblique. So what I'm going to do I have a few trial lenses, is I'm going to demonstrate what nearsighted astigmatism would look like at a -1, a -3, and a -5. But I'm going to show you those different meridians and how it changes so you can understand and get a better idea of what maybe your children are going through, your partner, other people you know that have astigmatism, or maybe yourself, understanding a little bit better on the effect of astigmatism and the vision. So as far as farsighted or mixed astigmatism, it would look the same way, but it would look more up close or intermediate range, or far and near. Demonstration coming right up. So now I'm going to do a demonstration of what astigmatism can do to the vision. I'm sitting here on my couch and I've got my TV paused. If I have a -1 astigmatism and it's in the horizontal orientation, this is what it does. In the horizontal, right here. There's vertical, and then there's oblique. Okay, now I'm going to go from horizontal, from oblique to horizontal again, out to vertical. -1 doesn't really do a whole lot. Okay, now we're going to go to a -3. This is where you should probably notice a little bit more. Okay, this is the horizontal position. This is the oblique, and here's the vertical. Okay, vertical, oblique, horizontal. There it is without. Now we're going to do it with a -5. Here's the horizontal. Here's the vertical. There's the oblique. You see that has the biggest effect on the vision. And back to horizontal again. So you can see when I change it, what kind of different effects it has on the eye. And so that's why all these other demonstration videos aren't coming close to showing you what actually it would look like with a different prescription. Of course, there's other variations such as age and distance. If I did this like looking at a mountain, it would have a bigger effect because it's further away. But as you can see on the television, what it does too, and these are rather large words too, so you can imagine what it would do to subtitles. A couple other notes. So let's say you have a 0.5 astigmatism. If it's horizontal, it's probably not affecting your vision much at all. And if it's this way, it could if it's in your distant dominant eye. So if it's nearsighted astigmatism, whichever eye is the distance dominant eye, then it may cause some issues with night driving. If you are right-handed, 80% chance of the time you're right eye dominant. You could be different like I am. 20% of the population is cross-dominant, right-handed, left eye dominant. By the way, that makes us bi-brained, which means we can be more balanced when it comes to analytical versus creative, the Renaissance brain, and we get bored easily. I've actually seen patients that have had higher than -5 also. I've actually had patients that were above -8. So you imagine what astigmatism can do the more you have. Be sure to check out part 1 so you can understand the context of this conversation. Understand that the way that you can address this astigmatism to reduce its effect on your vision, on how your eyes have to work, how hard they have to work, eye strain, fatigue, headaches, all the above. A 20/20 vision regimen, which is what I used on my astigmatism, is the answer. Blessings and namaste.